Bill 5444. And as we often do with this subject, we have Ellie Nicole.
That was a great introduction. Thank you. Honorable chairs, co-chairs, and ranking members, I am very happy to be here to speak in favor of House Bill 5444, an act requiring the licensure of art therapists. My name is Ellie Nicole, and I am nationally board certified as an art therapist. I would like also to thank Representative Belinsky and Senator Logan for their sponsorship of an art therapy licensing bill, and also thank the committee for voting to introduce it as a committee bill. In reviewing the bill, however, I found language that appears to contradict another part of the bill and also may continue to confuse the public about who is qualified to practice art therapy in a competent and safe manner and as regulated by the Department of Public Health. Let me direct the committee's attention to subsection 2C at the top of page 3 that would allow non-licensed persons to practice art therapy as long as they don't represent themselves as art therapists, which clearly contradicts the prohibition in subsection 2A against any practice of art therapy without an art therapist license issued by the department. I support the definition of art therapy on page 1, line 6. That clearly defines art therapy as a practice done by a professional who has completed a master's level degree approved art therapy program. I have submitted amended language in my written testimony to address this. I work with at-risk adolescents in an alternative high school in Bridgeport and in a practice in Danbury where I use art therapy with a variety of populations. One young woman left college midterm last year with symptoms of panic, hallucinations, and suicidal ideation, all due to a sexual trauma. Talking about the experience only triggered her symptoms. Engaging in art therapy, drawing out her fears, distorted thoughts, and injured self-concept enabled her to deal with her issues and heal and return to college the following fall. Her art will be on display Wednesday at Art Therapy Day here in the Capitol, room 310 from 12 to 4. You are all invited. I hope you can come. Art therapy is more than art and therapy. Art therapy is a distinct clinical and evidence-based use of art. Understanding how art interacts with a client's psychological disposition and how to safely manage and interpret the reactions different art processes may evoke are competencies that must be gained through substantial experiential learning that is unique to art therapy masters programs. In closing, I see individuals, groups, couples, and families. When I work with couples, I do not say that I am doing marriage and family therapy. I say I'm doing couples art therapy. When I see a family and I connect them with social services, I don't say I'm doing social work. As you look at the written testimony, you will see that we have strong support from the Connecticut Social Work Association, as well as New Haven Arts, and many other professionals and organizations that you'll see. But I want to be very clear that nothing in our licensing bill prohibits or restricts any other person from using art media in their professional practice as long as they don't represent themselves as art therapists or otherwise authorized to do art therapy. Thank you.
Well, thank you, Ellie, for your testimony today and for this testimony last year and the year before and the year before that.
Actually, we weren't here last year.
Oh, that's true. We took a year off. But we really do appreciate your perseverance and commitment to this task, and we recognize that you've been patient while DPH pursued its piece of the puzzle. And hopefully that makes sufficient difference this year, and
Yes.
we will give it consideration. I don't have anything anymore to add because I think I've heard some version of this a number of times, and we're very appreciative of how your profession has evolved over the years, too, to provide really tremendous assistance to a lot of people. So thank you for that. Comments, questions, members of the committee? If not, thank you once again for your testimony.
Thank you.
You're taking my list.
I'm trying to work with you.
Okay. No, I'm lost. Lost. Bear with me one moment. Amy Jetty, please.
Hello. Hi. Good evening, co-chairs, vice chair, and representatives of the Public Health Committee. Thank you for the opportunity to speak today in support of House Bill 5444, an act requiring the licensure of art therapists. My name is Amy Jetty, and I'm a master's candidate in Hofstra University's Creative Art Therapy program. I'm also a Ridgefield, Connecticut resident, and I am the president of Art in Common. It's a 501c3 based in Ridgefield, and so I'm very grateful to be here today. Art therapy is a unique mental health occupation that incorporates the disciplines of psychology and art creation. When a client cannot find the words to express a thought or feeling, the act of art making can provide access to a new system of communication. It is a form of creative expression that engages symbolism and metaphor through visual imagery. Art therapy allows the therapist and the client to use art to process information in a way that can surpass talk therapy alone. Often, unanticipated images arise during the creative process that surprise both the creator and the therapist and create an opening for valuable discussion and self-awareness. When a symbol arises in the therapeutic process, which exhibits a dysfunction, it can demonstrate problems ranging from early attachment issues to certain types of pathology. Sometimes a client feels a rush of emotional impulses and has trouble expressing them by talking alone. Art therapists are specifically trained to help the client understand what is happening and guide them in the healing process. As you're well aware, gun violence is on the rise. Traumatic events can be processed and visualized in a secure manner through the creation of artwork. Often, when clients are asked to verbally describe a traumatic experience, there is a risk of re-traumatization. Through art, trauma can be reintegrated into enduring memories in a sustained way. This facilitates memory reorganization and recovery. Helping a child convey these intense feelings using imagery encourages the construction of a new narrative for them. I work with at-risk children, families, and teachers who reside in high-risk towns. I recently worked with 2 public schools to introduce art therapy to 1,300 elementary and high school students. The children each had the opportunity to create a piece of art to be delivered to Marjorie Stoneman High School in Parkland, Florida, with personal messages of empathy and resilience. The community of Parkland plans to respond in kind. Through dialogue and discussion, the students learned new methods to use art to decrease stress, increase emotional regulation, and increase compassion even in their own lives. This is an opportunity to engender hope and strength among these communities, increasing bonds and rendering healing. In closing, art therapists undergo rigorous training resulting in a specialized master's education and preparation for a national board examination. While I applaud other professionals for using art in their practice, I would like to propose they use terms such as creative expression or group art, reserving art therapy for registered art therapists. It seems to be a reasonable solution where the benefits clearly outweigh any potential downside. In addition to protecting the consumer from misrepresentation of services, it will attract art therapists and recent graduates like myself to bring services and revenue to Connecticut. Thank you for this opportunity to testify.
Thank you for your testimony and for really being very serious about entering the profession. Hopefully at a very good time where we'll be poised to bring about the change that have been long sought in the state. Does anyone have any comments or questions? You sort of get the sense that, you know, we're pretty clear on this one.
Yep. Thank you.
Thank you. Next up is Brianna Ben-Morandi, I believe.
Close enough.
You feel free to correct me.
Brianna Ben-Morandi, hello.
There you go.
So I've submitted a written testimony which outlines just a few of the many client cases I've worked with within just the last year. A child on the autism spectrum, a teenager who was selectively mute, an angry, distrusting teenage girl, all cases where talk therapy was not the go-to solution. I was going to share these stories, but you have them on paper. And in sitting here today, a more important reason for art therapy licensure occurred to me, so I've amended my testimony. I began my private practice in September of last year. I am currently full to overflowing with clients. Good news for my practice, bad news for potential clients. I've begun trying to refer clients out, emphasis on trying. Most clinicians I know do not work with children who require more work for the same, if not less, pay for services beyond the therapy hour, such as communicating with parents and schools, the requirement of bigger spaces, and the provision of toys and art materials for communication. Children and teens also usually have to work around schedules for school, mom and dad's jobs, and extracurricular activities other than therapy, which allows for limited hours that a treating clinician such as myself can even fit children in. I have a maximum of 8 or 9 sessions a week that I can accept a school-going child. I often attempt to find a creative marriage and family therapist or a creative social worker to refer to when I come up short on finding a good fit with an art therapist. Unfortunately, even when I find what I feel is a perfect match, or as close as I can get, it's often not good enough. I was told by a mother last week that instead of going to a referral, she would prefer to be put on an indefinite waiting list for her son to see me. Flattering as this may feel to me, this is not helping her son. Just in sitting here today, I have followed up on 3 additional clients, referrals who I cannot see due to my full schedule that I need to refer out to. And if this is the case for an affluential shoreline town like Madison, can you imagine the need for the bigger cities? As art therapists, we have the same level of education as marriage and family therapists, master's level social workers, and professional counselors. We're not trying to take anything away from other therapists, such as using artwork in session. Far from it. The world needs more emotional healing through art. Rather, we wish to provide a clearer understanding of what art therapy is and what it is not, as well as exemplify its effectiveness, and we wish to be counted among the other hard-working, long-studying clinicians we work side by side with in the helping professions. There's a definite need for more mental health workers that not only work with, but specialize in the language of children. Many, if not most, art therapists are just that, and we need them licensed and out serving this need for people of Connecticut, just as art therapists are doing in the 12 states that have already have licensure, and hopefully soon in the 20 additional states currently seeking this licensure, including ours. Thank you.
Thank you for your testimony. I was particularly taken by the struggles many of your patients have to find somebody with the appropriate background, and if anything, we'd want to encourage more people to get into the profession. So thank you for that. Yes, Senator Cohen.
Hi, I just wanted to welcome Brianna because she's from the 12th District from Madison, and I was pleased to see on the testimony list how many licensed art therapists there are in actually the 12th District. I'm sure they're all over the state, but I was particularly pleased about that. And you've done such a good job at explaining this to me, and for the benefit of some of the newer legislators here who have not been through a couple of years of testimony on this. Could you just explain a little bit? I know there's dual licensure. Could you explain a little bit about why the need for this bill? I know we're talking a lot about the benefits of art therapy, but not so much about why there is a need for
the licensure. So I am dually licensed as a licensed professional counselor, but that is an additional 2,000 hours and an additional exam above and beyond what, say, my husband, who's also a licensed professional counselor, needed to do to get licensed and go out into working in the field. So a lot can happen in that time it takes to do another 2,000 hours. And to be honest, I've just come back to art therapy after being away for 10 years. So a lot of people may not see it through as I didn't until just recently. And this is one of the problems leading, because there's not as direct a path to licensure as there are for social workers, LMFTs, and licensed professional counselors, that a lot of art therapists are being told or are not seeing it through to go that extra mile. There's also the question of, well, it's really hard to market yourself as an art therapist because a lot of people don't understand what art therapy is, and it doesn't help that many other people who are not master's level educated psychoanalysts are saying that they also do art therapy. So it's a much more uphill battle to get where I currently am in my practice for most art therapists.
Thank you for that. I was perhaps not helpful to my new members of the committee to assume that everybody was as familiar as those who have been on the committee for a while were. So thank you, Senator Cohen, for giving her the opportunity to provide a more clarification. Any other questions or comments? If not, thank you. Welcome back to the profession.
Thank you.
And hopefully we'll have something to talk about soon.
Thank you.
Next up is Tess Hannifin.
Hello. Mr. Chairman, Madam Chairman, members of the committee, thank you for this opportunity to testify. My name is Tess Hannifin, and I am a new art therapist from New Haven, Connecticut, and I am here in support of the House Bill 5444, an act requiring the licensure of art therapists. So a little bit about art therapy, not to be redundant, but it's always an honor to advocate for my profession. So as different as all of us humans are, we all have the commonality to want to be seen, heard, and understood, and could all use the benefit of mental health counseling. But what if you are unable to be accurately seen or heard? What if you are unable to access these truths that may be shameful to discuss? And what if talking is not enough? We are all different learners, such as auditory, visual, kinesthetic, tactile. So wouldn't that make us all different expressors? Creating art is another form of communication. It is a different angle of analyzation, an entirely different language, if you will, that allows us to express things that we are unable to articulate with words alone. It provides a platform to better understand aspects of the self that would otherwise not be accessible. We take in life through seeing, feeling, and doing. We literally live visually. If we're taking in these images through visions that allow us to recall how we felt, then how does solely talking about these past events and feelings seem like enough to get an accurate perspective of our lives? Whether it's through the sensory benefit of the tactile art making or the satisfaction of creating something that gives a sense of accomplishment, art adds a deeper layer that only the unconscious can access. I work in a dementia unit, and as was previously mentioned this morning about someone with Alzheimer's and the difficulty it is to communicate, I can say firsthand how impactful and beneficial creating art with these residents has on their quality of life. It gives them a sense of control and autonomy, and they're able to communicate, and they are validated. With the help of a licensed art therapist who has the artistic knowledge to help guide those who are not as acquainted with art materials, as well as the counseling and psychology education background in order to safely facilitate a deeper understanding of the artwork and reflect aspects of a person's psyche, one can receive the appropriate help to learn this very special creative process. It's like learning a language, but once learned can be used to unlock what was previously unable to be expressed. The committee is aware that many art therapists have been licensed in Connecticut as professional counselors. However, recent legislation approved by the General Assembly and signed by the Governor as Public Act Number 1794 will restrict eligibility for counseling licenses beginning January 1st of this year only to persons holding master's degrees from counseling programs that have KCREP accreditation or related programs that closely correspond to KCREP standards and curriculum. This will effectively deny the last available option for most art therapists in the state. Just one more minute, is that okay? Thank you. Without a separate art therapist license, it will be increasingly difficult for graduates of the Albertus Magnus College Art Therapy Program, as well as programs in neighboring states, to obtain licenses and practice in Connecticut. There will be fewer qualified and licensed practitioners to meet the state's urgent need for mental health services, less diversity and innovation in mental health practice, and no assurance that residents of our state who need art therapy services will receive them from appropriately trained, qualified, and licensed art therapy professionals. Addressing certain things about yourself is hard, but seeking the help is harder, and by allowing art therapists to become licensed mental health providers, it will only allow for more people to gain more access to the treatment that they deserve. Thank you for this opportunity to testify.
Thank you for your testimony. I also really like using 3x5 cards or 4x6.
A little flimsy.
Thank you particularly for your emphasis on the dementia community. You know, the state of Connecticut is growing at a rapid rate. We know that there'll be more and more patients with various forms of dementia, and it's wonderful that this form of therapy is so helpful to them. So thank you for that. Are there any other comments or questions? If not, thank you very much.
Thank you.
Last up on this bill is Amanda Valerio.
Good evening. Madam Chair, Mr. Chair, and members of the committee. My name is Amanda Valerio. I am here on behalf of House Bill 5444. I graduated from Albertus Magnus College in 2017 with a Master's of Art in Art Therapy. I have provided clinical art therapy at hospice care as well as at a substance abuse clinic. Currently, I provide these services for children and families at a nonprofit company in southeastern Connecticut. I am here today to advocate for art therapy licensure and for further recognition in the mental health field. I find myself frequently justifying art therapy as an evidence-based practice. Each week, hours that could have been spent with clients are spent advocating for the use of art therapy in sessions. My colleagues and supervisors are immensely supportive. However, they struggle to understand the profound effect that art has in therapy. Recently, a 12-year-old female came to me with comorbid symptoms of depression and anxiety. We began our episode of care by treating her symptoms of depression. It became apparent through our conversations and through the artwork that we were making in sessions that she could benefit from art therapy focused on treating her anxiety. It was through her artwork that I was able to discern the need for a shift in treatment. In following sessions, I engaged her in art therapy directives proven effective in treating anxiety. In a short period of time, she made significant progress in an increase of ability to identify her anxiety symptoms, as well as to use art as a coping skill. This was evidenced by an increase in school attendance, an increase in social engagement, as well as an interest to join the school's drama club. This is just one example of how art therapy has been effective in treatment. I believe that the licensure of art therapists in Connecticut would lead to more time spent meeting clients' needs and less time spent trying to justify why I am using art therapy in session. This would also lead to more effective mental health services in our state. Thank you for this opportunity to testify.
Perfect timing, what? I think you get an extra reward for that. Thank you for your testimony. We all recognize how valuable the therapy is for people with various forms of anxiety, and it was a particularly wonderful story about how well that particular subject turned out. Joining the drama club, boy, that's a huge turnaround, I would have to say. So I think it gives us all a sense about how successful this form of therapy can be.
Thank you.
Questions or comments from members of the committee? Now, thank you for taking the time to be here today. Really appreciate it. We're going to move on to